myself Himani Sharma from RPIIT campus. In today's class, I discuss about the Alzheimer's disease. Alzheimer's disease is a degenerative brain disorder of unknown etiology with is the most common form of dementia that usually starts in the late middle age or in old age, result in the progressive memory loss, impaired thinking, disorientation, and changes in personality and mood. There is the degeneration of brain neurons, especially in the cerebral cortex, and presence of the neurofibrillary tangles and plaque containing beta amyloid cells. The disease was first described by Dr. Alois Alzheimer's, a German physician, in 1906. Alzheimer's had a patient named Augusta D. in her 50s who suffered from what seemed to be a mental illness, but when she died in 1906, an autopsy revealed dense deposits, now called neurotic plaque, outside and around the nerve cells in her brain. Inside the brain, inside cells were twisted strands of the fiber or neurofibrillary tangles. Since Dr. Alois Alzheimer's was the first person who discovered the disease, Alzheimer's disease was named after him. Meaning, Alzheimer's disease is a chronic irreversible disease that affects the cells of brain and cause the impairment of intellectual functioning. Alzheimer's disease is a brain disorder which gradually destroys the ability to reason, remember, imagine, and learn. There are the comparison of a normal age brain left and an Alzheimer patient brain right. Difference characteristic and point out. About 3% of men and the women ages 65 to 74 have the Alzheimer disease, and nearly half of those aged 85 and older may have the disease. About 3,60,000 new cases of Alzheimer's are diagnosed each year. Causes. The cause of Alzheimer's disease is not known, however, several factors are thought to be implicated in this disease. Neurochemical factors: acetylcholine, somatostatin, substance P, neuroepinephrine. Next is the environmental factors: cigarette smoking, certain infections, the metals, industrials or other toxins, use of cholesterol lowering drugs, statin. Next is the genetic and the immunological. Genetic and the immunological factors: oxidized LDL receptor and angiotensin 1 converting enzymes are tied to the way brain cells bind to appropriate the apolipoprotein 4 and reduce the buildup of harmful protein known as the plaque in the brain respectively. Risk factors: Down syndrome, family history, chronic high BP, head injuries, gender, smoking and drinking. Now today class I discuss about the following risk factor and the neurological factors. Thank you for watching.